Dr. Fred, do I have your permission to record?
Of course.
What's up, Flexies? Good afternoon, good evening, or good morning, depending on what part of the world you're watching us from. If this is your first time watching, welcome. You're going to be in store for a great podcast. As always, here's what I can tell you about my podcast. You never know what's going to happen. Right? I call it the unknown. You never know. Just got off with three lovely ladies, and man, we had the time of our life. We were laughing so hard it split my stomach wide open. So you never know what's going to happen. But if this is your first time, my name's Chris Eryx. I'm the host of Flex the Truth podcast, otherwise known as Baby Trump. A couple of housekeeping news. This Saturday in Gainesville, Texas, that's right here in Texas where I live, at the USA Trump store off of I-35 Frontage Road. We're going to be having our event. I'll be emceeing it. My good friend Jim Price from the Jim Price Radio Show, Dr. Brian Artis and Rick Renee will be joining me on stage, along with likes of Chad Prather, Alan West, and so many other people. If you're local, come out, bring an open mind, open heart, but most of all, bring a chair. It's going to be a beautiful day. God already told me so. We're going to have vendors, bring children, bring teenagers. We got something in store for the kids. We got miniature horses, face painting, bounce houses, and uplifting music. So October 30th, I will be in Wichita, Kansas. Jim Price will be emceeing that show. I'll be on stage sharing the likes of Lee Valentine, good friend. We're going to have her on the show tomorrow, Brad Barton, and Jeff as well. The other thing I want to talk about is my website. My website's totally getting overhauled. We're getting everything on one spot. I'm so excited. I can't wait to see it. The merchandise store, the sponsorship page, all my videos, say all my videos, whether it be on YouTube, BitChute, Brighteon, CloudHub, any of those, Rumble, guess what? They're going to be online on my website. So that way, if I ever get taken down, God forbid, go right to flexthetruth.com. That's flexthetruth.com. Sign up, get on my mailing list. You'll see a calendar of events. And then now you're also going to see a page where not only you can donate, to my podcast and ministry, but you can also hire me to speak at your event. So want to get all that squared away. The new shirts are on the website as well, so you'll be able to order them. Hoodies and hats are coming up next. Probably have them within the next couple of weeks. So stay tuned. Again, go to flexthetruth.com, get on the mailing list. So I've got a special guest, and although I never met him in person, I actually met him through a good friend of mine, Mark Victor Hansen. If you don't know him, and Chrissy, they are the authors of Chicken Soup for the Soul. So we're actually in talks, maybe doing a book together. And that's his good friend, Dr. Fred Moss, who's the author, CEO, president of Welcome to Humanity. Dr. Fred, are you there?
I'm here. Good to have you, Chris. Thanks. Good to be here.
How are you, brother?
I'm doing great. I've really been having a spectacular day. And if you really, truth be told, I've been having a spectacular life all the way from the very beginning till now.
Look, this is what I say. Number one, it's a miracle that we're here. It's not by accident, it's by purpose. You know that as a doctor, right? Mm-hmm. What are we, like 1 in 1 trillion, right? And then, once we're, the embryo and the not the embryo, the sperm and the egg come together, it's 1 in a trillion shot. And then after that, it dies down. But we're truly a miracle. I say that to everybody that I come across, because sometimes we lose sight of that, Dr. Fred, is that we are a miracle. And more importantly, we are to be here. This is not by accident. This is on purpose. We are to be here and to be battle tested for such a time as this. Mm-hmm. I just want to open it up to you. Tell the Flexies and their loved ones, who you are and what you're about.
Thank you. Yeah, sure. So my name is Dr. Fred Moss, and I am physician. I'm a healer by nature. I've been a healer long before I went to medical school, but I did go to medical school in 1984 to 1988 in the lovely town of Chicago, Illinois. And so I absolutely adore Chicago. I went to Northwestern, and since then I did my residency in psychiatry, and then in child and adolescent psychiatry. And then I was a psychiatrist for the last, approximately the last 30 years, a little bit more than that. And I had been in mental health since 1980. And I guess I should go back to that point, because right before that, I had dropped out of college and I was never going to do formal education ever again. And I got a job working with kids in a state hospital facility. And I really got what I already knew, which is that people really just want to be heard. People really just want to communicate and be connected with. People really just want conversations that they resonate with. And there I was dealing with the kids, dealing with these children, some of them with pretty unfortunate circumstances. And we were healing each other. We were just having beautiful conversations. I worked afternoon shift. We could play ball. We could go on field trips. We had meals, and I helped them get to bed at night. And the one thing that was so disturbing to me was how psychiatry was dealing with these kids. And we had a psychiatrist in the facility, and we would call the psychiatrist and let him know that the child had been agitated at night, or maybe wasn't doing what we said, or, got in a fight with his peer. And all of a sudden the psychiatrist would show up, have a one sentence conversation with the kid, write some order, and then we'd have to hold the kid down and jam him with an injection of some medication. And if the child didn't speak or wasn't in trouble for the next 24 hours, we called that a success. Now, that wasn't a success for me. That was ludicrous atrocities. And I could only manage that for so long. I have the aptitude, I have the passion, I have even my brother, who was a psychiatrist 14 years older than me. And it was just decided that I would go into psychiatry and actually bring communication and connection back into the field rather than this medication stuff. Well, while I was in medical school, Chris, Prozac was introduced, and that just changed the whole world of psychiatry. And one could say the whole world of all things. Because psychiatry became biological at that point, or at least pretended to be biological. And there was this new notion of a chemical imbalance that these medications were supposed to fix. So all of a sudden, in the next few years, I had become an expert in providing medications when I had actually gone into psychiatry so that I wouldn't have to do that. And there I was, for the next several years, I had 40,000 patients in my career. And over the last 15 years, I've decided to start backing out of that, started, undiagnosing, unmedicating, and then undoctrinating people. So basically getting that the diagnosis itself is where the original insult comes, meaning it lets people know that they are less than perfect, which isn't true. All of us are perfect. And some of us are having very difficult times. I don't mean to diminish that in the very least. You already mentioned that. These are difficult times. Having a lot of pain, having a lot of misery, having a lot of fear, anxiety, depression. Well, those are functions of being human, not functions of being sick. And I really began to stabilize my healing skills when I started to really get that I wanted to see people eye to eye rather than from the power gradient of a doctor and a patient. So I started to see people from eye to eye, unloading their diagnosis, which of course, if you don't have a diagnosis, then you don't need treatment. And if you don't need treatment, then you don't need medication. And if you don't need medication, then you don't need a doctor. And if you don't need a doctor, then you get to have your life back.
Right.
And that was really happening, and it was happening regularly. And look, it's not for everyone. I want to make this clear to your listeners as well. If what you're doing is your diagnosis and your medications and your treatment is actually working for you, then by all means, continue doing that. This is not for people who it's working well for. This is not to diminish anyone who's actually finally found a space that they can, survive in this crazy world and they want to keep it there. That's fine. I'm not speaking to those people exactly, other than with due respect and power to you to have found something that actually works. What I'm speaking to are the people who it didn't work so well, or they continue to get worse. The opportunity really exists to have a whole new life based on communication, connection, and creativity, based on being gotten, based on being heard, based on self-expression. And that's the kind of thing that I've really been focused on over the last several years. So as a clinician, really, I've become one who's a transformational coach or a restorative coach. somebody who actually gives life back to people who had already sold it down the river. You know, with a diagnosis, you get, it's not just a label, you get to sell half yourself down the river. And I'm saying, you know, you can unload that diagnosis should you choose. And for instance, you know, my diagnosis, I have a diagnosis, it's called I'm Fred Moss. And your diagnosis, you could probably guess what I think your diagnosis is.
I'm Chris Eryx.
That's who you are. And that's it. And that's your diagnosis. And that's what it takes to be Chris Eryx, is being Chris Eryx each and every minute. And I'm here to now announce, you know, to now be a stand for Welcome to Humanity, which is all of the things of life, from the very most difficult to the very most beautiful, are all inherently part of this life experience that we've been given by our creator, the creator that allows us to be creative in our own right, the creator that allows us to work together with other humans to make this world a better place. And as a contribution to that, really the best way to do it is to be there for others and be a tremendous listening for others so that they feel gotten. I guess that's a pretty good overview of who this guy, Dr. Fred, is these days. So thanks for asking.
I love that. So, you know, we talked, and, you know, I vet my guests, and especially like if I haven't met them or spent time with them, that there was something that was inside of me that really spoke to my core, and you hit on it. You know, you said about, you know, you have a diagnosis of, you know, being Dr. Fred. I have a diagnosis of being, you know, Chris Eryx. And, you know, you consistently have to be Chris Eryx. You consistently have to be Dr. Fred. Most people, Dr. Fred, don't know who they are.
That's right.
And so they get caught up with what the world wants them to be, and kind of try, you know, I remember being young and being a salesperson and being like, oh, I'm a chameleon. I can sell to anybody. You know what I mean? If you're a Black African, I'm Black African. If you're Jewish, I'm Jewish. And as I got older, I was like, wait a second, who the hell am I?
Mm-hmm.
And I literally, 48, so what, 4 years ago, 4 years ago, after my dad passed and I was losing my mom, I went to this landmark. I don't know if you ever heard of it. They're world renowned.
I'm way deep in landmark education.
Okay.
I've more than heard of it, Chris. And it's funny that we talk about this now, but I'm super familiar with landmark.
Okay. So I'm here on my podcast, and you'll love this. You bring a smile on your face. But when I speak, I'm to touch, move, and or inspire people.
Yeah.
Right.
Mm-hmm. Yep.
Straight from landmark. But when I went there, you know, I didn't know who I was. And so, you know, being all these people, because I would, you know, go along and get along, right? Be a chameleon, be a people pleaser, but I didn't know who I was. And it was at Landmark that 3 days that I found out who I was. Mm-hmm. And for the first time in my life, Dr. Fred, I lived in the moment. Never knew what living in the moment was. If I was to watch something or look at something, I always found the negative part of it. I'd always find something wrong because I wasn't living in the moment. The minute that I lived in the moment, oh my gosh, I remember going to Disney World or Land, the one in Anaheim, and being like, oh my gosh, like, because I was living in the moment. So everything was more vibrant. Music sounded better. Food tasted better, right? Yeah. And when you live in that moment, because you know who you are, and to what you say, you know, the connections, you know, what do they want us to do now? Stay away, 6 feet away. Don't talk to nobody. They're completely trying to isolate us. You know what happens when you isolate people? They become depressed. What happens when people become depressed? They need medicine. Suicidal tendencies. Suicide is the highest it's ever been right now. And it's only going to get higher because we're isolated. So to what you said, I can resonate, you know, because it's all about connecting. It's all about connecting with one another. And I love that you're about that. And that's what we got to do. My last name, Eryx, actually means missile, which I tell people it's to break down barriers of all sorts. It's to break down barriers and for us to connect again. Get off our phones, connect. I love Zoom because 2 years ago, when 19 happened, guess what? I got to still connect with people through Zoom.
Yes.
You know, when I talk to people, I like to see them. So I tell them, I don't have FaceTime, let's duo one another. It's still that connection. And here you'll love this. Did you ever soul gaze?
I'm
Do
sorry.
you know what do you know what soul gazing is?
Yeah, a little bit.
Okay. Did you ever soul gaze with somebody?
I go ahead and continue. Let me hear where you're going with this.
So I learned this, a program I saw a couple of years ago where there was a guy that was prejudiced. He was prejudiced against Mexicans. And they put him in a room and they faced one another, literally 3 feet apart, 2 feet apart. They weren't allowed to say anything. All they had to do, and all they could do is stare at one another. That's it. That's all they were allowed to do. And are you there? Can you hear me?
I'm here. I'm here.
Hold on for a second. My sound. I just heard my sound go off. Give me 1 second. Can you hear me now?
Oh, yeah. Can you hear me?
Yep, I can hear you loud and clear. Okay, good. Okay. So what happened is now they're staring at one another. They're not allowed to use words. And when they first did it, man, it wasn't good. He looked at this guy like he wanted to kill him, right? So they did a DNA test. And with the guy that was prejudiced against Mexicans, guess what? He found out
Mexican. I guess he's Mexican. My guess is he's got some Mexican.
Now they put him in that same room with that guy to start to soul gaze. And the dude broke down. He broke down and literally cried. Like, you know, that ugly snot, right? Because he was so sick to his stomach. How dare he, right? How dare he have this prejudice against this, you know, human, and here he is, right? So I learned that, and you know, when you soul gaze with somebody, here's what it does. We all use words to communicate, yes or yes, right? We use body language. But when you soul gaze, you are looking and staring at another person's eyes. You are literally looking in the window of their soul. That's why it's called soul gazing. Do you know most people can't look at somebody for more than 5 minutes without turning away, you know, because of that intimacy, right? If you want to be intimate with somebody, soul gaze with them. Soul gaze with them for 30 minutes. Soul gaze with them for an hour. You really want to know what a human's made of? Soul gaze for that.
Yeah.
You know, and what I'm doing is, you know, my sponsors and stuff like that, the people that I'm intimate, I'm soul gazing with them because I want to know who that person is.
Yeah.
And really get to know a human inside in their soul.
Beautiful.
And so when you talk about welcome to humanity, you know, those things that I've learned, you know, through the years, through, you know, obviously Landmark, you know, and even, you know, people like you and just being a sponge in personal development. That's what my show is about. You know, yeah, we have guest stars on. Yeah, we talk about what's going on in the world and God, family, freedom, but we talk about personal development. And that's what I love about you. Here's what I want to ask you. You know, with all the medical tyranny going on, right? What can people do to get off of the drugs?
That's a great question. So thanks for asking it just so straight up. And one of the things it's going to take is reconfiguring and recontextualizing the narrative that supports the drugs being used in the first place. So on the one hand, one can see that it's not actually the drugs that are the problem. Look, we don't blame rat poison for killing rats. Rat poison's just rat poison. It comes in a bottle or comes in a tray, whatever it comes in a tub, and it's rat poison. It's fine. It's what it's for. It has an intended purpose, and what it does is you feed it to rats and they die. It's not the rat poison's fault. In the same way, the medicines are not at fault for creating the problems that people have by taking them. Now, we could start looking at a couple of different things. Well, what should I do then? Well, you went to a doctor, you got your confirmation that there was something defective about you, something different, something that needed to be addressed through the possibility of a chemical rebalancing agent. And then you went to the store, went to, Costco or Target or Walgreens or wherever you did, and you gave them that piece of paper, and then they gave you a little can of pills, a little tub of pills, and you started taking them. And then every single day you take them. Now, if every single day you take them and you get sick or you get worse or it's making you worse, that's no longer the medicine's problem. I mean, the idea, it's not your problem either. I mean, there's a whole system in here. Your family, your friends, your caregivers are all telling you to take medicine because they are all assured that you have this condition. Maybe you have bipolar disorder, you have schizophrenia, you have ADD, you have social anxiety, you have, whatever you have, like depression or anxiety or post-traumatic stress disorder, all these psychiatric diagnoses. And once you believe that you have those diagnoses, well, then now you believe that you need something to counterbalance.
So it's a story you're telling yourself.
It is the stories that you're telling yourself. And look, I want to make it clear what I've already said, which is if the story that you have told yourself has now made your life workable, then by all means, continue doing exactly what you're doing. Congratulations, more power to you. And I really mean it. Like, that's great. This is more for the people who think that they could have a greater life than what they're getting by accepting their diagnosis and their medication. So when you ask, how do you come off medication? Probably the quickest answer to that would be consider the possibility that all you really are is a human struggling with human care, human needs, human wants, human desires, human wishes, human experiences, human emotions, and that as in a human, we're all walking through life relatively aimlessly. We need whatever we need, whatever downloads we might get from out there, or whatever we're learning by being with others, or whatever we get from internally, wherever our spiritual, our emotional, our intellectual selves go to, our physical selves, that's what we're going to learn, and that's what we're going to respond to. So if what you're looking at is to get off of medicine, but you still think you're defective, then it's not going to work very well. So one of the spaces you got to get to is maybe you're not defective. Maybe you're not afflicted. Maybe you're not diseased. Maybe you're not, limited by some particular diagnosis. Maybe you're not less than another human. Now, when you get that, that's when it starts to back off, that you start getting, I am whole, complete, and perfect. And from that whole, complete, and perfect, I get to back off and realize, okay, I'm struggling, but that doesn't make me sick. Chris, we don't blame a log for burning in a fire. Am I right about that? It's not the log's fault. When you get put in a fire, it's hot and you burn. And in our lifetime right now, there's many different areas that are very, very uncomfortable for everyone, not only for the people who agree with us on particular topics, also for people who disagree with us on a particular topic. It's simply uncomfortable out there. So one of the things we might be able to do is just like hover over the top of this human experience and get that each and every one of us is struggling with our own sense of reality, our own sense of desires, our own sense of core wounds, our own sense of resentments and regrets, and our jealousies, our small egos, our big self, our connection to the eternity. These are things that we're all struggling with. And when we really get that we're doing that as a brotherhood or as a fellowship anyways, of 7.8 billion people doing it simultaneously, well, then medicines start to be really less interesting after all. And now it just starts being like, take care of yourself, keep it, watch the toxins, do good things, be kind, and, be wondrous and be curious and connect with people and, do service and create art. And there, do mindfulness, watch what you eat and watch what you drink, and use your skills properly and be humble, and all those things we already know that they work. Go ahead and tap on those all day long. And when all else fails, Chris, when all else fails, one of the easiest ways, and I speak to this in my book, Creative 8, is help anybody do anything.
I was just thinking that. Be a servant.
If you don't have anything else to do, if you're feeling kind of lousy, if you're feeling self-hatred or, some imposter syndrome, or you're feeling sad, scared, anxious, I got a plan for you. Go help anybody do anything. Help anybody do anything.
Mm-hmm.
During that time, all symptoms that you have will disappear for sure.
I was just, as you were saying that, that's exactly what I was saying.
Yeah.
And if all else fails, just be a servant. Serve.
Yeah.
When you serve others, man, it's so funny how your symptoms that you think you have are there. It's the most selfless act you can perform to another individual. And the other thing, as you were talking, I had to download, and it was, we are human becomings.
Hi, beautiful.
We are not human beings. A tree is a tree, is it not? It can't be anything else other than a tree. A human can change. Here's what I tell people in my speeches. Hey, are you happy with today? And congratulations, just like you said, everything you have today, congratulations, you deserve it. You deserve what you have, everything you have in your life, because of your decisions and your choices. Now, here's the best part. If you're not happy, guess what? Start all over. You can change today.
Right.
You can literally change today. A tree, if they don't want to be a tree tomorrow, can't say, I'm tired of being a tree. I want to be a flower. Mm-hmm. No. Right. We are so special creatures. That's why I say we're a miracle, because we are human becomings. Mm-hmm. We're never finished. Mm-hmm. We can always change. We can. I hate the word evolve, because I think you're evolving to something, right? But I think you could always change if you don't.
You might want to, even the word transform is one you can steal here, and feel free to use the word transform even.
But I love that, because when you say that to somebody, they're like, well, no, I'm a human being. No, you're not. You're a human becoming. It's what you're becoming. Because you have now until the day that the Lord calls you back to home to become whatever you want to be. Mm-hmm. And we always talk about careers. I had one guy say to me, he's like, you were a model, you were a Chippendale dancer, you Playgirl Centerfold, you had a construction company, you had a reality show, and now you're an evangelist and a podcaster. Oh, you're full of S. And I'm like, why? Because I had all those careers. You know what I mean? Like, I've always was transforming. Mm-hmm.
Beautiful.
And you transform up until the day you die.
That's right. Every single minute. That's right. Every single minute you get to show up with infinite amount of possibilities, and you're the author of your own life. And the possibility really exists that you can do something different than the habits you have had up until now, starting now, that would be totally new and totally generated and totally innovative from right here, right now, instantly.
Exactly. People are going to watch his podcast, and I'm talking to somebody out there right now. Like, I know this is going to change your life. Mm-hmm. I know it. I know right now I have a download that at least one person will watch his podcast and go, oh my gosh, they changed my life. Just that conversation, because you never know. That's why I tell people, walk around with an open mind, an open heart, right? Because if you open your mind and you open your heart, you never know. Like, if you're always learning, you're either growing or you're dying. Mm-hmm. You know what I mean? It's not one or the other. I would say either closer to God or you're closer to Satan. Mm. Well, you can't say that to me. Oh, I can. You're either closer to God or you're closer to Satan, you know? And so it's when you put it like that, Dr. Fred, so black and white, sometimes it scares people.
Yeah.
And there's other people that go, wait a second, this makes sense now.
Mm-hmm.
You know,
Yeah.
I know a person, they were on Adderall for 15 years. They were on Xanax for 15 years. The story they kept telling themselves was, I need this. I need this to get through my day. No, you don't. I have ADHD. That's a story you're telling yourself.
Exactly. Yeah.
Right. And so, 15 years, you're on Xanax, you're on Adderall. Okay, let's wean you off. You're weaned off. Guess what? They're now a month, no Adderall, no Xanax. And oh my gosh, now they feel everything, Dr. Fred.
Right. Exactly. Right.
You know what I mean? Like they have now like come to life and they're like, oh my gosh, you experience everything, living in that moment.
Yeah.
Feeling that because most drugs mask what's really the problem, right? And also mask you feel, right? Or you thinking, or the way that you think. I call it stinking thinking, right? And so, oh, you know what? I need that. I need that to get through my day. Or, I'm just going to keep the Xanax, in case, I have a panic attack, one day. No. Burn that shit. Burn that shit. And get rid of that. And then let's see how you are. That person's like, man, I'm a totally, and that the light in that person's eyes, boom, it flickers.
Yes.
It flickers now. There's light. You can see it. Before they felt nothing. Now, the reason they were really doing it was because they were shutting people out. And they didn't want to feel. But they kept telling themselves, oh, I need it. Oh, I need it. I need to get through my day. That's what an alcoholic does. What a drug addict does. It's what a gambler does. A sex perp, right? They say, I need it. I need to get through my day. Drug addicts are always thinking about their next high. How can I get? Oh my gosh, I had a construction company 19 years at lunch. If I said, what are you thinking? They're like, how can I get my next high? How can I get my next high?
Yep.
And that's and they can't focus the rest of the day. They're useless.
Yeah. Yeah, that's right. There's really this, it's not the thing about these medications or about these drugs is that they're designed, they have sort of an extra kicker that makes things a little bit difficult, which is upon discontinuation, most of these drugs or medicines actually give a surge of the symptoms that are marketed to treat. So when you discontinue, you get a surge of whatever it is that you thought you were taking the medicines for. So, and then you're faced with this conundrum of, well, I didn't like being on medicine, but actually coming off medicine is even harder than staying on medicine. So I think at this point, I'm going to go back to my medicine because it's the worst, it's the best of two evils. Now, what we should know is that these medications, that aspect of it, the surge of the symptoms it's marketed to treat, excuse me, is temporary. And so, once you get through the first 15 days or get through the first 30 days, it starts losing its grip on you. Your red cells start realizing that they don't need this stuff. These are medications that really find and are pretty gripping, especially like the two that you named. So I want to make sure that your listeners aren't just like, taking their Adderall, throwing it in the garbage and saying I'm a free person, or taking their Xanax and throwing it in the toilet and saying, okay, now I don't have panic attacks. What you have to do, however, is really get to the point that you're ready to, like you said, literally transform your life, literally come from an entirely new paradigmatic foundation. And if you can do that, if you're ready to do that, well, then it's possible to lose your diagnosis then lose your medicine, and then lose the reason to have to go to a mental health doctor.
That's right.
It's really cool. Yeah.
100%. Yeah. Well, this has been a whirlwind. This has been so exciting. How can people get a hold of you, Dr. Fred?
Yeah, the best way to get a hold of me, I mean, I'm on Facebook and LinkedIn, and that's fine to get a hold of me. I like doing talks. I like doing group talks or even keynote speaking. But the thing I really like doing is as well is coaching. And as a transformational restorative coach, really just not only walking people off their medicine, but helping people find their true voice. So in the world of like what you said, 4 years ago, you said people don't know who they are. I actually have it that people do know underneath all of their noise, they do know who they are. And all these things have covered over the top of it to have us convinced that we're someone different than who we are. So what we do is really unconceal or take away the things that are in the way of who we know ourselves to be as an authentic person, and really bring people's true voice forward. So I have a program that I've developed recently called True Voice Podcasting. And True Voice Podcasting is a way to find your voice and then deliver it as a podcast host, even if you ever thought you couldn't do it. Because, you and I are having a lot of fun being podcast hosts. And there's a lot of people who would really have a message that they're ready to bring out to the world. So the best way to do that, the best way to find me is my email, drfred@welcometohumanity.net. Or you can find me on LinkedIn or Facebook. And I'm also, I also got handles on Twitter, YouTube, and Instagram. And, I look forward to talking to anybody who wants to learn a little bit more about what it means to really, really undiagnose oneself, unmedicate oneself, and then undoctrinate people. So really finding a true voice and bringing the authentic message to the world.
Love it. Thank you so much. And, I always believe in the power of prayer. I always believe that there's only one healer. That's it. And it's Jesus Christ Almighty, our only Father, our true Father. And I always say, listen, look, if you got to get right with the Lord, you got to repent. Good point. Now is the time. Yeah. Now more than ever, if you don't know who Jesus Christ is, if you don't have Jesus Christ inside your heart, just raise your hand up. Just say, hey, listen, Lord Jesus Christ, I invite you into my heart, into my soul, into my life. I denounce Satan and everything evil. Thank you for giving your only begotten Son to die on the cross for me, for my sins, for being such a wretch and have such grace and mercy for me. I know I'm a child of God. I repent my sins up until now. Thank you so much for your unconditional love. And I know I'm heaven bound. If you just said that, congratulations. Dr. Fred, thank you so much. It's been an honor. It's been a pleasure. We'll have you on the show again. Love to talk to you more. But guys, remember, flex your mind, flex your muscles, flex the truth. You're now aligned with God. You can go out and do his work, his way, doing his will, but more importantly, his words. Guys, bless up. Have a blessed day. Thank you, Dr. Fred.
Thank you, Chris. Thank you. It was great.
Bye.